healthcare payers have difficulty managing and organizing their fraud, waste, and abuse leads and then turning those leads into cases. Even once they do this, the working, ongoing management and reporting of these cases is often disjointed and incomplete due to a lack of proper tools and technologies with overly manual processes. This common problem could be solved by better integrating the efforts of SIU and overall payment integrity initiatives. Joining me to discuss this issue is Mark Isbitz, Vice President of Program Integrity for Claris Health. Mark, what are the problems that health plans face when trying to address fraud, waste, and abuse?
Well, most statistics show that at least 7% of healthcare spending is made up of some sort of overpayment. Overall, that's $400 billion at least, and only 5% of that is expected to be recovered. So even though, even bigger than the fraud, waste, and abuse, some of that is handled by the audits team. Some of it may be handled by SIU. And it's often entirely disconnected from the SIU. So these data silos are primarily the result of outdated and inadequate solutions, and the consequences can be dire for the health plan. So what are those consequences? Poor communications within the SIU and throughout the payment integrity team as a whole, so beyond the SIU. Lack of efficiency to get through all the leads and cases in an appropriate manner. Lack of effectiveness in thoroughly managing cases, which can lead to missed savings opportunities and really undetected fraud, undetected payment policy gaps, and even undetected inabilities to follow contract terms, both on the provider and on the payer side. And finally, the inability to report on SIU progress and the ROI of the SIU in a very timely and effective way, which also prevents them from meeting state and federal reporting guidelines, especially for those plans that are Medicare Advantage or Medicaid HMOs.
That sounds like a really big problem, Mark. How do health plans address this disconnect?
Well, there are a lot of different ways because fraud, waste, and abuse isn't necessarily separate from the overall payment integrity initiatives. Just the way they go about them may have some similarities and some differences. But ultimately, they have the same goal, which is paying claims appropriately and efficiently. So when you bring the SIU into the fold, you're talking about comprehensive technology that increases transparency both within and across the silos that go a long way towards helping with that goal.
Got it. What benefits do you see from integrating SIU and payment integrity?
Well, there are a lot of benefits, but I think there are really 5 major ones. The first one is certainly increasing that speed to decision making, taking action, and resolution of the issue. So that could be anything from doing a recovery and post-pay to putting a provider on a prepay initiative, provider education, which is very common. And ultimately, if it's egregious enough, they may decide to go and prosecute. That's usually the last resort, however. Second of all, it's going to reduce false positives while increasing your true positives for improved efficiency with the investigators. False positives are the bane of many investigators' existence because they have an enormous amount of leads and possibilities that they need to go through, and sometimes it is looking for a needle in a haystack. Third would be improved transparency of the SIU process, both within the unit and also across the entire payer enterprise. Fourth, reducing that provider abrasion. So this leads to the previous issues I talked about all lead to potential issues with the providers because, number one, they don't really like to be accused of fraud, waste, or abuse. In addition to which, if it's a false positive, then it just makes the payer look bad, and it just creates some bad friction within the provider community. So the fifth and final one is easier tracking of the SIU team's ROI and efficiency, which helps automate what is today a very manual reporting process. Some of that is due to technologies or process, which again are typically might be a little outdated, and the amount of reporting, especially that they have to do for the government agencies such as CMS, OIG, and state reporting, it's just an enormous amount of work, and it requires a lot of automation in order to become more efficient.
So, Mark, it sounds like there's a lot of benefit to, looking at payment integrity and SIU holistically. What is it about the Clarus Health fraud solution that makes it different from existing tools that are used by most health plans today?
Well, Jason, most other solutions on the market today, including homegrown solutions, lack a lot of functionality that's really needed. They lack the ease of use and integration to other parts of payment integrity. So therefore, not only are they becoming siloed, but they're also preventing the other areas of payment integrity from accessing and utilizing the information that the SIU has, which could help them as well. At Clarus, we offer a modern approach that incorporates all aspects of the SIU investigator's case management experience. As an integrated part of the payment technology platform, Perio, the Perio Fraud Case Management Solution offers a very comprehensive web-based solution for your intake, your management, your dissemination of information and cases, the decisioning component, and the tracking of leads and cases that are the result of fraud, waste, and abuse. Perio Fraud, the case management component, also helps aid in healthcare payers in quickly identifying gaps and growth opportunities around that medical savings. So it's very comprehensive, very easy to use.
Well, thanks so much for taking the time, Mark. If you'd like to have an exploratory conversation around your fraud initiatives or see Perio Fraud in action, feel free to reach out to us at info@clarushealth.com.